my name is Deboho. I'm an occupational hygiene technologist working at the Occupational Hygiene Division. I majored in physiology and environmental health for my undergraduate and currently doing public health for my postgraduate degree.
Hi, my name is Vusen Klebi. I am an epidemiologist working at the Epidemiology and Surveillance Division. I studied BSc Medical Science and majored in medical microbiology for my undergraduate degree and public health for my postgraduate.
Hi, my name is Mpume. I'm a medical doctor by training, specialized in occupational medicine, which deals with health-related issues from what people are exposed to from their work or workplaces. I work in the occupational medicine section.
We are currently looking at the informal waste reclaiming sector and investigating their access to healthcare, their occupational exposures, as well as health outcomes that may result from such exposures. Waste reclaimers are a growing population of informal workers that are a common sight on our landfills as well as the city streets. They have been affectionately known as the silent environmentalists, as they improve recycling rates and prolong the operation life of our landfills. While there have been growing concerns for their well-being during reclaiming activities, there has been little assessment of what they are exposed to and how it may be affecting their health. Our research aims to address these gaps and inform government bodies on interventions that can minimize the burden of disease in this sector. We currently have projects at 6 landfills in Gauteng province.
I'm assessing respirable particulate exposures in waste reclaimers and the respiratory symptoms that may result from the exposures. Respirable particulates are small particles that remain suspended in the air long enough to be inhaled. The size of the particles is very small, smaller than red blood cells, which can be at the size of 6 to 8 micrometers. This means that these particles are small enough to reach deep into the lungs where gas exchange takes place. When the exposures are high, the lungs are not able to remove the particles adequately. This can result in chronic respiratory conditions. I will quantify particulate exposure levels as well as reporting of respiratory symptoms while controlling for non-occupational causes such as smoking and use of fossil fuels. I will do this to determine whether there is a correlation between the exposure and the symptoms reported.
I will be responsible for the data management of the project. Once the raw data has been captured, I will clean and analyze it using one of the computer software programs available to us.
As part of the team, we will be looking at health hazards or exposures, self-reported health complaints from waste reclaimers, and screening for the two most prevalent non-communicable diseases, namely hypertension and diabetes. We will also try to find out if waste reclaimers do have conditions that will require them to access health facilities, as well as their barriers, if any, to access health care.
While there has been studies that have reported on health effects that may result from handling of domestic waste, there have been few studies that have investigated exposures in waste reclaimers. As this sector continues to grow, this may prove pivotal in preventing disease and promoting decent work for waste reclaimers.
The informal sector is a growing economy globally. One of the reasons is that there are no aspirations towards being formalized. The nature of work for waste reclaimers is considered to have potential exposure to health hazards and resultant health issues. However, the income-generating activities compete with the need to access healthcare services, and thus these workers forfeit their access to primary health care, which includes screening for common health conditions. Given the occupational exposures to various hazards during their work, it is necessary to establish if these workers can be better provided with means to access healthcare facilities.
A major challenge when conducting research in this sector has been low participation rates. This was possibly due to fears that findings may result in waste reclaimers being restricted to enter landfills. Levels were found to be well below occupational legislative limits. However, the reported symptoms may indicate that current limits may pose a threat to respiratory health. It was also found that particulate composites may prove pivotal in the level of toxicity, so variation in composites may vary from one landfill to the next.
Our research is still in the early phases, and we will be conducting health risk assessments as part of gathering information on exposures and exposure profiling.